So my name is Phil Cham. I'm a medical physician. I run the Rhode Island STD clinic over at the Merriam Hospital, and I work part-time for the Rhode Island Department of Health as their medical consultant. So I got involved with Project Renew for HIV and STD testing. I used to come down here and actually perform STD testing for the clients of Project Weber. Male sex workers and female sex workers are at incredibly high risk for HIV and STDs, and I do what I can to provide some clinical care for the clients here. Currently, I serve on the board of directors for Project Weber Renew. I help assisting as I can, especially with the clinical aspects, some of the research capacity and other issues that arise. I really believe in the organization. I think its mission to have peers especially deliver services throughout the community makes it unique and really fulfills a much needed gap in the community. I think as clinicians and medical providers, we can do what we can, certainly to provide medical care, but we're not out in the community. And I think that that's especially the niche that Project Weber Renew fulfills. I think they get out there, I think they understand the clients, I think that they can really meet their needs the way that we in the clinical profession at least can. So pre-exposure prophylaxis, or PrEP, is a daily pill that prevents HIV infection. It's a medication that was approved by the US FDA in 2012. But uptake around the United States has been slow, and especially for many populations that can benefit from it, like male and female sex workers. We have a research study in collaboration with Brown University. The goal of that project is to look at providing case management services and peer navigation services to clients specifically of Project Weber, male sex workers, to provide them with this medication. So I think there's lots of unmet need. This group really has a whole host of medical problems and other sort of social determinants of health that include housing, substance use, mental health, transportation, basic life necessities. You know, if I were given $1 million to help address this problem, I think I would centralize a whole bunch of services under one roof for this population. I would build one large center for this group and really co-locate things like substance use, mental health, primary care services, HIV, STD testing, as well as just make it a safe space that people can come and receive the care that they need. I think the next up-and-coming thing for harm reduction is to really work to making our services more accessible to clients in general. So a lot of times, at least in the clinical field, we talk about patients coming to us, but I think for clinical services and other harm reduction services, we actually have all the tools in our toolkit to address HIV, to address substance use, etc. I think what we're working on now in the field is how to effectively deliver those to the people that need it most, including those of the clients of Project Weber Renew. How can we think about bringing the services to the people rather than having them come to our services? So Project Weber Renew is a grassroots organization that really depends on your donations. There's lots of NGOs and other community organizations out there, but Project Weber Renew really is out in the community serving the needs of their clients. This group of men and women are really one of the most underserved populations in our state, and every penny that you give, we don't have a large operating budget, every dollar that you give really goes a long way to support the approaches and the innovation here at Project Weber Renew.